outside devices. These devices have flooded into the market, and what it has done is it has increased the cost of your surgery, and sometimes the cost of meniscal repair is even higher than the cost of the primary repair of the reconstruction of the ACL. My practice is in Nepal, and you know that Nepal is one of the poorest in Southeast Asia and one of the poorest in the world. And on top of that, if you see the insurance system of Nepal, it is in very, very primitive stage, and I deal with 90% of my patients, they do not have insurance coverage. That means they have to pay the treatment out of their pocket. This is one of the papers that I always, consider when I deal with these patients. Say that 50% do not undergo surgery due to affordability, and this remains for general surgery, the basic general surgery. Now you consider arthroscopy surgery, which is very costly, this number goes even higher. So more than 50% they cannot afford surgery. And these are some of our papers which says that many meniscal tears are identified intraoperatively, for which patients were not very well counseled for repair. So you cannot repair. So you have only two options when you see intraoperative injuries. One is meniscectomy, either you meniscectomize, or you have to have a cost-effective method which can be utilized to repair the meniscus. This is one of our technique, which is known as suture shuttle technique. This is essentially an outside-in technique that we have been doing since 2013, and this was published in prestigious arthroscopy technique, our technique of outside-in repair, which is essentially very, very cost-effective in our practice. And if you read recent 2024 literature, which says that there are no difference between any of these techniques, provided you have performed a very good repair with the basic principles. And since 2015, we have recorded 726 meniscal repairs with the outside-in technique and with the success rate of 94%. And this video shows that this is on your left is the meniscal repair, and the relook arthroscopy says that beautifully healed meniscal repair. The outside-in technique has a circumferential compression, which is very, very essential for meniscal healing. But we were taught that there are Jones-specific repair devices, and we all were taught that posterior bones, especially in the lateral meniscus as well as in the middle meniscus, you need an all-inside device. And at this moment, the market is flooded with all these all-inside devices, which are, some of them are extremely costly. If you look into these devices, what are these devices? The costly devices. It has a delivery system, and it has a suture and anchor network. These anchor network may be all suture type, or it may be a PEEK type. But what is important to understand for the people who work in low middle income country is that only 7,000 out of 45,000 Nepali rupees which cost this all inside device, only 7,000 is used, this is the suture or anchor. The rest of the device, they are thrown away. And every day if you use all inside device, you have garbage of money going into the money of the patient going into the garbage, So what we thought that rather than having a disposable, costly handle, can we make a reusable handle? So this brought us to develop a AJ stitch, which is nowadays very popular in my country. This is a very simple device, similar to all inside device. You have a reusable handle and reusable needle, which is attached into the handle. Then you pass the tube, which is disposable, and now your device is ready to be used. So its advancement is a rotating platform which will adjust the length of the tube, that will give you an idea that where exactly or how inside, how depth you have to go inside. So this is the anchor. This again made in Nepal. It's a very simple anchor. You just load that anchor into the needle and your device is now ready to be deployed. And what is important is only the anchor will be deployed and the device will